So in this video I'm going to talk about the Menetriers disease. So let's see. Menetriers disease is a hypertrophic protein losing gastropathy. Means what will happen? Here the proximal part of stomach is mainly involved. There is foveolar hypertrophy, means foveolar hypertrophy. Surface mucus glands will be hypertrophied, which are secreting the mucus, so there will be increased mucus production so much that the protein loss will occur. That is the most common cause of death. And why will this hypertrophy and this thick mucosa is happening? Due to increased TGF alpha, means tissue growth factor is increasing so much that it will lead to the surface mucosal gland hypertrophy and very thick mucosa and giant rugae, very deep creeps, and this will look like a cerebralization of the stomach, all cobblestone appearance of the stomach. So this we have to remember. Now the symptoms will be, there is diarrhea cause absorption is not happening properly, that will be, so it will lead to weight loss and pain will be there, and features of hypoproteinemia. So this four feature we have to remember: pain, diarrhea happening, so protein loss will be there, so hypoproteinemia, and weight loss cause there will be anorexia, nausea and dyspepsia. Okay, so just remember that there is lots and lots of mucus, so protein loss will be there, so pain, diarrhea, weight loss and features of hypoproteinemia. Now investigation, we can see by endoscopy cerebralization of stomach and cobblestone appearance. We can also see in the CT scan. If the patient is asymptomatic, if the patient is symptomatic, we will do the symptomatic treatment, that is PPI, H. pylori eradication will help, and protein supplementation we have to give, and in some case we have to do total gastrectomy. Now the other condition is gastric volvulus. So what will happen in the gastric volvulus? Let's see. First, what is volvulus? Volvulus is any hollow organ will rotate on its own axis or pedicle, and if it is a solid organ we will call it a torsion. Now it can be of two types, organoaxial or mesenteroaxial, means stomach is rotating on its own axis, and mesenteroaxial means stomach is rotating around the mesentery. So both condition is slightly different. So let's see here. Anatomical predisposing factors are present, like we have seen the hiatus hernia. In hiatus hernia mainly the rolling type, where fundus is going up due to weak ligament or ligament rupture. There will be complication of the volvulus, and the presentation will be acute, and complications are more here, like gangrene is seen. So organoaxial is more complicated, and with more complications like gangrene, presentation is so more severe. Well, mesenteroaxial is no anatomical predisposing feature, complications are rare and mostly resolved by own, and it will be recurrent condition. So patient present with pain, vomiting, but it will resolve on its own, and it will happen again. So it is a less severe condition, but it is a recurrent one. Now what is a Borchardt triad that the patient will present? So patient will present with the pain, retching, you can Bore how. So the symptom will be similar to this, like we have seen that retching and pain was there in the Borhouse syndrome triad was Meckler's triad. So there will be pain, retching and but there was emphysema because it was a esophageal perforation there. And here what will happen, that inability to pass the Ryle's tube. Okay, so pain, retching, but without vomiting. Here there won't be vomiting because gastric volvulus is that there is total obstruction and inability to pass the Ryle's tube. Okay, now what will be the investigation? So we can do the CT scan, barium meal. In barium wheel we can see the cascade sign, cup and spill sign, and endoscopic derotation we can try, but it is generally not that much successful. So ultimately we have to do the laparotomy and we have to derotate it, and we have to fix it to the anterior abdominal wall. So it is called as anterior gastropexy, and if gangrene we have to cut it out the stomach, so gastrectomy. Now what is bezoar? Bezoar is a foreign body in the stomach, and foreign body can be of many types. Either it can be trichobezoar, that is hair, phytobezoar, that is vegetable fibers, metal bezoar if metal is stuck, pharmacobezoar if the drugs are enterocoated tablet, and if gastric outlet obstruction then drug will accumulate, that is pharmacobezoar, and lactobezoar means milk products will be there. And after partial gastrectomy, bezoar is slightly more common, and so we will write this. Okay, after partial gastrectomy, bezoar risk is more. Okay, now there is trichobezoar condition that we have to learn. So trichobezoar, tricho means hair and bezoar means lump of foreign body in stomach. So it is related to the psychiatric disorder trichotillomania, in which the patient will be generally young female in second decade, mostly associated with bipolar. So what will do, it will pluck out the hair and eat it. So also patchy alopecia, and we can see the hair ball in stomach. Due to trichophagia. Now presentation will be, there will be obstruction, so vomiting and pain. Now it can also called as Rapunzel syndrome. On examination, we can feel the firm lump in epigastrium which is mobile. and shows indentation. Now the investigation is CT scan and ultrasound, and surgically we will remove this condition. One condition, that is dyspyrobezoar, it is due to persimmon fruit and which contains xylitol, and this xylitol, it is a soluble tannin which contains soluble tannin. Okay. So this is all about this 3 condition.